Well, very good morning to all of you. So today our first part will be the continuation of what we discussed last time about stress management part. After that, we will have time for the next two sessions for more practice, where we will be practicing some meditations that we learned earlier. And I will introduce only one more meditation today, which is the light meditation that I think I mentioned the name earlier. Light meditation I will introduce today. So that's the only new one. So we will have time for questions, discussions while we go through the meditation sessions. So any doubts you have, you can ask today, since we have almost completed most of the theory part, and it is the practice part that we will highlight today. And use the chat if you want to pass any message to me, or you can use voice. Well, where did we stop? We covered the definition of stress. We found that when our thoughts interfere with the homeostasis system, we call it stress situation. Then we identified the hindrances are the main causes for the stress to arise. But hindrance will arise basically due to a situation. Some situation where you perceive that your abilities are not enough to cope up with the situation, or the given time is not enough, or there are obstacles coming in your way and blocking your way in achieving whatever you want to do. Okay? So when you feel that way, when you perceive that way, hindrances will arise. And when the hindrances are present in the mind in higher levels than normal, which means it's like out of proportion, power of the hindrance is growing out of proportions, then the mind will give the commands to the endocrine system, the immune system, and the three systems I mentioned that day. The mind gives commands to those systems to get ready with more energy, so that some kind of action is required now. For that purpose, stress hormones will be released to the blood, and the whole body will be energized in order to go for explosive action to cope up with the situation. That part we discussed. And then we also discussed what are the organs in these three subsystems and what kind of hormones they generate, and different purposes of those hormones we discussed that day. Then today we are going to discuss about the coping up strategies when stress situations occur. Right. About the stress and the depression, we tried to demarcate between the two last time. I kept this slide on for a longer time than usual so that you can read it and get an idea about get a comparison between the two. There are a lot of similar symptoms, but symptoms like withdrawing from other people and thoughts of suicide are special for depression. And stress has these symptoms like trouble sleeping, feeling that you have a lot of work to do and overwhelmed with work, and you will experience problems with memory, trouble in concentration, change in eating habits, feeling nervous or anxious that something serious is going to happen, and irritable, easily frustrated. And you feel burned out from studying or school work or workplace. You get a feeling that you can't overcome these difficulties in the life, and so have trouble functioning normally. Those are the symptoms of stress, and these happen due to stress hormones present in the blood over a prolonged period of time. I mean, more than necessary. They are supposed to be in the blood, circulating in the blood for a shorter duration, only until that stressor fade away. Only until that stressor fade away. But if the mind is unable to perceive that the stressor has faded away, stressor is not there, stressor is no more there. If the mind is unable to feel that way, then the mind will not command the subsystems to remove these hormones from the blood. They continue to circulate in the blood, and thereby damaging various subsystems that handle these things, that create these things. Some damages to the homeostasis system will take place. So that's the part we were discussing. Now that stress being fairly common nowadays, that anyone will from time to time experience stress due to different scenarios unfolding in the life, like sometimes the loss of relative, loss of a loved one, and sometimes if you could not do an exam well, there are various occasions where stress level will rise, and since nothing is permanent, that situation will decline. And it is important for us to remember to support the mind in order to relieve from the stress once it is gone. So that relief part is what we are going to discuss now. So we know this mind-body interconnection is what we are actually discussing, where we discussed that this part, the mental part is dealing with the feelings, perceptions and all. And the brain is interfacing it with other three main subsystems, ENI subsystems, and various parts of the body like brain, nerves, skin, heart, stomach, pancreas, intestines. They are all possible to be subject to damage if stress hormones are not purged or released out of the blood when the stressor is no more there. That's why properly managing the stress is important for all of us. Throughout our lives, these skills of managing stress will be useful. And for managing stress, there are four different ways, different ways. The four is categorized into two main categories based on what we are going to do with the stressor. First category is we try to change the situation. Situation means the stressor. Stressor is coming from a stressful situation. So one option you have is try to change that. Try to change the situation so that the stressor will not harm you. But there are many occasions where that won't be possible. that won't be possible, and change that stressor or stressful situation could be inevitable. In that case, we have to switch to the other option, that is change my reaction, change the reaction. So what are the techniques for changing the situation? What are the techniques for changing your reaction? We will discuss options available. Change the situation is like reacting outwards, that you have faced a situation and you would want to change the outside situation. Then change your reaction means you don't try to change the outside, you try to change within you, and some internal adjustment will be done to the mind in order to alter your reaction. So one approach is external, the other approach is internal. Okay. When we consider the first approach, then change the situation. Under that, there are two options available to you. Two options available to you. One is to avoid the stressor. Maybe you can, certain cases, you can run away. And to run, the body will be energized by adrenaline and GCs, those hormones. The body will be energized so that you have energy to quickly react in order to avoid the stressor. Okay? This could happen happen very quickly, so that sudden reaction is possible. Second option, alter the stressor. If you can't avoid, you can try to alter it. Like you can talk to the relevant people and see whether an alternative could be arranged, something like that. So abiling means you run away. Altering means you don't want to run away, but you want to relieve the situation so that you can face it. Adjust the situation in such a way that you can face it. Okay. Then change your reaction. Change your reaction. Again, there are two options available. One is to accept the stressor. Accept the stressor as it is. So that needs some internal adjustment in the thoughts, right? Internal adjustments in the mind. Other is adapt to the stressor. Of course, accept and adapt could go together, right? First you can accept, then you can adapt to it. So they may not be alternatives, rather than, other than that, they can be combined into your strategy to cope up with the stress. So these are called 4 A's of stress management. Avoid, alter, accept, and adapt. Avoid and alter belong to the outward approach. Accept and adapt belong to the inward approach. Hope this summary is clear to you. Well, you can ask any questions, right? Well, when we try to accept the stressor and adapt to it, that needs a change within the mind, change in our perception about the stressor. We need a change in attitude. Changes in attitudes are not easy to come by. We have to purposefully train our mind for that. But these to avoid alter, they could be sometimes spontaneous. You might not need big training for that. This part needs change in the thinking process, how you perceive the stressor, and attitude towards such situations, we can build up positive attitudes in such a way that our minds are ready to handle such situations. So those are the managing techniques. But you know, some of these managing techniques are not good in the long run. In the short run, they may be okay, but in the long run, some of these managing methods can harm you. Okay, especially in this area, alt avoid part, the external approach can have that kind of issues. Okay, so remember the 4 A's: alter, avoid, accept, adapt. Let's look at it more closely now. This diagram you may remember. We have the psycho system, which is the mind, with these capabilities, like it can derive meanings out of situations, can generate emotions, it has beliefs, it has some self-image about yourself. Mind has instincts, mind has habits in behavior. So the behavioral science normally study this area under psychology. And then we have this nervous system, endocrine system, and immune system coupled tightly with the brain. And when we say brain is like the input-output processor, it is acting in 2 ways. It could be the input-output processor of the mind, so that mind can use the brain to deal with the rest of the body, all the muscles and all other organs of the body can be dealt with this input-output processor called the brain. Plus, the brain also has other input-output devices external for the external world, which is the eye, which is the visual cortex part, the eye, the ear, the nose, tongue, and the rest of the body, which detect the touch. So those 5 sensors which interface us with the external world is also controlled by the input-output processor. So when we say input-output, it's in 2 levels. One level is input-output to the external world. Other is input-output to the internal body, organs. So both are handled by the brain. Let's look at what these subsystems do under each situation. We have 4 areas to discuss there. We'll take them one by one. So here the three systems will be responding depending on what decision you take here. Right? So that suppose you decide to go for change the situation, that means you want to try to change the external world in such a way that you are safe or you can handle the stressor. Then when you take that decision in the mind, sometimes that decision could be spontaneous, sometimes after thought process, then the mind will inform that what to do to the brain, and brain will relate it to the nervous system, endocrine system, and the immune system. And those stress hormones we discussed will be activated for altering the stressor or avoiding the stressor. That is a decision you take, either one of them. So for example, if you want to go away from that place, if you want to run away, you take that decision, okay, I want to avoid. I want to avoid. So I want to go away, and that decision is taken. And how fast you should go away from that place will be decided by the mind and will inform to the brain and the three subsystems to prepare the body for quick action, like running, okay, or bodily activity, basically. Right? And that is exactly the purpose of adrenaline, GCs, catecholamines, they being released to the blood. This is exactly the purpose, so that the body is ready for quick action. Extra energy is released. Now, let us assume that the body reacted in the way you wanted, and you are successful in avoiding, or you are successful in altering the stressor. If you are successful, what happens is the mind will get the information through the five senses like eye, ear, nose. Using those sensors, the mind will collect the information whether stressful situation is still there or not. So if the mind perceives now, okay, running away has been successful, avoiding method has been successful, or altering method has been successful, when the mind perceives that, then it will issue the commands to the NEI systems. Okay, now everything is fine. Those stress hormones are not required in the blood anymore. Please purge them. The three subsystems will oblige and purge those stress hormones out of the blood, and the body will be normalized. So homeostasis system will not be damaged, will be okay. So this is the expected outcome, But there are exceptions. That means there are some minds, some people, some minds, which don't want to believe that stressor is gone. Suppose by you avoiding technique or altering technique, you manage to take the stress away externally. In the external world, the external situation has eased out, but the mind don't want to believe it. Some of our minds don't want to believe that it's gone. It is still worrying, will it come again? Okay. That kind of worries will remain here. Therefore, as a safety measure, because it might come again, it will not give the command to the brain or NEI systems to take that stress hormones out of the blood. It will not give the command. It's a decision by the mind. Although externally stressor is gone, the situation has eased out, the mind, as a precaution, don't want to believe it, and for a prolonged duration, stress hormones will be maintained within the blood. Think about it. Is it happening to you in some scenarios? It may happen. It may happen that the mind will delay removing the stress hormones from the blood. So this is where the psycho part is coming. It depends on why you delay it, depends on your habits, depends on your instincts, depends on your beliefs or your emotions. Due to those, the mind will not feel. Mind will not feel that the technique was successful in altering or avoiding the stressor. So this is the scenario. This is the scenario that stress hormones remain in the blood for a prolonged duration, leading to acute stress, and episodic stress, and the 3 levels of stress I mentioned last time. And finally, the chronic stress. So then what should the person do? If this happens, first thing is awareness. Okay, this is what is happening to me. Then second thing is to find a way to confirm to the mind, so that the mind will believe that things are okay again. That needs little internal adjustments as well. So for that, there are simple techniques like music, physical exercises, so that the attention of the mind will be taken to something else rather than worrying about the stressful situation. Since the attention is shifted to some other activity, this expected removal of the stress hormones from the blood will take place. So that's one method you can try. Hope that cycle is clear. Right? What I'm trying to say is that this cycle could be a vicious cycle. It can become a vicious cycle if the mind doesn't want to adjust to the stressor being relieved situation. Vicious means if the mind does not believe, sometimes it will give a further command to increase the activity. Then it will monitor the external world again and will still not believe that stressor has been released, and will give command to further increase the stress hormones. Likewise, it can even be a vicious cycle. When it goes to that level, it is definitely chronic stress, because the mind is accelerating the stress hormones further and further in the blood. Okay. So in something I want to discuss here is that in your attempt to alter or avoid the stressor, there are good methods, there are bad methods. What are the techniques you use to avoid stressors? When the workload is heavy, suppose you have a lot of work to do tonight, what kind of techniques the mind will use? Okay. There are unhealthy techniques, and there are good techniques for avoiding the stressor or altering the stressor. Let me first give you a list of unhealthy methods of avoiding stress or altering stress. You can check whether you follow any of these. Well, some people do smoking and take the attention of the mind to that part, that smoking activity. And of course, it relieves the stress to some extent. Right? So one way of coping up, trying to coping up with the stress, but we know it's unhealthy. Some people opt to drink alcoholic things. Okay. Some people who may not go to smoking or drinking will adapt to overeating or undereating subconsciously. They don't know why it is happening, but they will take more number of meals per day than usual when the mind is under stress. For some people, it's undereating. They will avoid even the usual meals. Well, then this is another one, spending hours in front of TV or computer. Right? You may choose a computer game, or you may choose a TV show or a film, and usually they are not short, you know. So you will be spending hours in front, or too much time in that activity, leading to further stress, because then the work to do will build up during that. Another reaction some people do is withdrawing from friends, family, and activities. So that you want to cope up with the problem yourself, alone. Some, especially not in Sri Lanka, in many other countries, they use pills and drugs for relaxation. Those are very common in other countries. Those drugs are freely available, and many will daily use in other countries. But in Sri Lanka, it's not that common. Sleeping too much. Okay, that's another unhealthy reaction to stress. We know when we sleep, the mind will reset a little bit, and the stress belief that the stressor is present is decreasing. It is not so influential. But again, that can become a habit, and you might, and subconsciously, you will be sleeping too much, right, without knowing about it. Procrastination means delay or postpone action because there are a lot of work to do. You will not start any activity and delay and postpone starting the work. That's called procrastination. Some people make it a habit, unhealthy reaction, because they are not aware that this is unhealthy reaction to stress, but they know it works in the short run, so they have slowly adapted to that. Some others think, okay, if I work very fast, I can complete all that, so that they fill up every minute of the day in their plan. And that is also very unhealthy reaction to the stress. Taking out your stress on the others, that means you will be very irritable and easily agitated, and you will get angry very quickly. Okay, that also is a stress reliever, right? Anger is a kind of a stress reliever. We know it is the hindrance is behind that. Hindrance will become forceful, and you will take out your stress on someone else by blaming them or fighting with them. Temporarily, stress will be released, but this becomes a habit, and in the long run, it becomes very unhealthy reaction, leading to further stress in the long run. So I could list only 10. There may be more here, because I'm sure by now you have your own ways. Maybe you have subconsciously developed your own ways of handling stress. But now it is time that you consciously become aware of the techniques you are practicing, and check whether they are healthy methods or unhealthy methods. These coping strategies on the screen, they temporarily reduce stress, but they cause more damage in the long run than good. So if you have any of these being practiced, or any of these have become habits, well, take immediate action. Switch your technique to a healthy method. So what are the healthy methods then? We'll look at this side now. There are healthy methods like music, which I will include in the later slide. But before that, we will go to this other method also, other option also. Right? Let's assume that the mind decided to change the reaction internally rather than trying to change the outside world. Or rather than trying to avoid the stressor or alter the stressor, your choice will now be, okay, let the stressor be there. I change my way of looking at it, or I change my way of reacting to it. For that, you will either choose, you will do first accepting the stressor, okay, let it be there, and then internal adjustment, which is called the adapting to the stressor. will be activated. So that happens here in the thinking process. When that happens, the brain will inform the input-output processor accordingly. Okay. NEI systems will be informed, okay, it's okay to have the stressor. This is what should be done. So in that case, stress hormones, release of the stress hormones will not be excessive. There will be a certain amount of stress hormones released, but excessive amounts will not be released. Not only that, they will not be there in the blood for a prolonged period of time. Since we have two problems. One is the level of the hormones in the blood, if they should not be excessive. Second is, even if the level is low or correct, it should not remain in the blood for a long duration. So duration is one issue. Then one issue is duration. The other issue is the level of stress hormones in the blood. They not being excessive is very important. So these accepting and adapting strategies always help to drain the stress chemicals or stress hormones out of the blood, because it's an internal adjustment in the thought process, which leads to draining of the stress chemicals out of the blood. And it can repair the immune system quickly. Right? Especially these days, you know, immune system is very important. Everyone wants to keep it on alert. And you know, if immune system is over alert, that's also an issue. I think about this COVID situation, you know, that first the immune system will take over and fight with it within the first few days. After that, for some people, some of their bodies, the immune system is hacked, which means the immune system release these cytokines in the blood while fighting the virus, will be searching for the similar viruses or similar things everywhere in the body. And in searching, it will find that there are similar shape, similar weight, molecule type proteins inside the inner lining of the blood vessels inside the lungs, and also inner lining of the intestines. They're actually good proteins, but they look like the virus. They look like the virus in size and in shape, in behavior. And the immune system is fooled, thinking that this is the virus. So this cytokine storm will attack all that inner lining of the lungs, causing pneumonia, and all the inner lining of the intestines, causing bowel movements. And that can sometimes cause the death. So you can see the immune system, if it is overactive, or if it is hacked by fooling it, then it could be damaging. It will attack the body. The body's own immune system will attack the body parts. So immune system must be active at the correct level. The mind plays a major part in that as well. Right? Exact relationship between the thoughts and the immune system are not clear, but there are some evidence that the immune system, healthy immune system, needs healthy thought process. Then what do we need? We need to perceive the stressor in a different way by changing our attitude or the way of looking at the stressor. Well, accepting the stressor, how do we do that? How do we manage? One option available is for a meditator, now that you know every part of the body, physical things, or even the thoughts or the mental states, they are all arising and fading away. And you have seen it through the meditation many times. And you accept that impermanence is the law of nature, law of the nature. And you slowly start believing change is inevitable in the nature. Therefore, accept the stressor, accept it as a natural phenomena. It's not abnormal, it's a natural phenomena. I'm just presenting a way of thinking. I don't know whether it will fit into your thought process, but it will definitely fit into a thought process of a good meditator. Accepting it as not an abnormality. Accepting it, having this kind of stress situation or stressor is normal. It's part of the nature. And that way of thinking will become an eye-opener for the mind. So because the mind is already looping like this, mind is looping with the thoughts about the stressor. So that internal mental loop is locked onto the stressor now. By force, you will introduce a new thought, originating from your previous meditations. Like what? Like, okay, this is nature, but anything is impermanent. It's not going to remain. So that kind of a thought, I'm just suggesting that there may be other ways. You inject into the mental loop by force and let that thought run multiple times over a fair amount of duration within the mental loop, so that you can prevent the mental loop locking onto the thoughts about the stressor. Otherwise, the thought process will hang on and lock onto that. This has many positives because it has some cleaning effect in the thought process and resetting effect in the thought process. So that's one way you can use to accept the stressor. Of course, this is if you can't simply avoid or alter, right? You can try them first, but you don't need to get stuck there. Right? Then if you think it's inevitable, well, option is accept it. Then have a strategy to adapt to the stressor. Adapting could be like various ways. One option is see it as opportunity for growth, or opportunity for change. Like sometimes competition can be a stressor, but it could be an opportunity as well. So that way, it's a change of attitude. Grab it as opportunity and exploit the inevitable. This sentence I learned from our late Vice Chancellor, Dr. Arthur C. Clarke, when he visited the department somewhere in 2008, if I remember correct, for an exhibition held by our students. They were showcasing their projects. At that time, they were June term projects and final year projects. And he always visited such occasions. And when he went around and was speaking to us, he said he had a life motto. He had a life motto, and he spelled out the motto as avoid the inevitable. Avoid the inevitable. So when there is some inevitable situation which can cause stress, he always find an avoiding technique. And it has been successful. That's what he told us. Few years later, on another occasion, he visited the department and he recollected that he spelled out his motto as avoid the inevitable, but he told us, I changed that motto. Although it helped me over a long time in my life, now I realize it has a drawback. I have changed my life motto to this, exploit the inevitable. So that's where I learned this, exploit the inevitable, and I would like to pass it on to you as well. So that's another way when inevitable scenarios, when we have to face inevitable scenarios, you can have an attitude, okay, it's an opportunity. How can I exploit it for further developing myself? That's another way to think, right? And it could be an opportunity to adapt to a new lifestyle, right? Opportunity to adapt to a new lifestyle. And adapt to be more simple than earlier. Like for example, the COVID situation, you can see, well, it's an opportunity to be more simple. The complicated lives that we had are all disrupted now. All those big dreams of success maybe temporarily is reduced now. And it's an opportunity to learn to be more simple in lifestyle, so that you have to restrict all your extravagant movements, activities, and everything. So some people can think of, okay, it's an opportunity coming for me to learn the nature or be with the nature and to be more simple. Okay, these are all thoughts that you can inject into this thought loop, right, for adapting. And also it is an opportunity to be more conservative than earlier. Okay. And nowadays, these coping up techniques have become a topic called mental health management. Mental health management. Earlier it was called stress management. Now the word common is mental health management, where what I have listed are many popular healthy options available. Earlier I presented some unhealthy options to alter, avoid, accept stressors. If you have those unhealthy methods, you can now decide to switch to these healthy methods. Well, one option is, for example, if you choose this option, managing your time, making a to-do list and all that, you purposely insert breaks or relaxing times into the timetable. Of course, the university timetable may not have that much of relaxing time, but I mean, at least after that time. So while you are in the job, out in the industry, always have break periods, so relax time, flex time in your time management. That's one option, one healthy method. Physical exercise to divert your attention elsewhere. The mind will be reset, and also it's good for the body. The stress hormones will be removed. Physical exercises. Another healthy method is using music for relaxing or enjoying. There are relaxing music, there are enjoying music, two different categories. Relaxing music you can use for meditation. There are meditation techniques based on music. For non-meditators, actually. For good meditators, they might consider music as a distraction. But non-meditators, it's a good technique. It really works with non-meditators. You can also choose, like listening to short bursts of music that you like or relaxing music in stressful scenarios. It's a healthy habit. And having a hobby or two and changing to that activity, hobby activity, switching to that activity when a stressor trying to take over is another healthy method. Nature walks and being with the nature, admiring the nature, like growing plants, that kind of activities could be adapted as a stress reliever. Then, spa therapy, they are special. They cost more. Right? Therapy is needed only if you can't cope with that yourself. You may need the support from the others. Well, the lowest cost option are here: meditation or yoga. Yoga is also a kind of meditation where the body and mind will be considered together, whereas meditation is mostly focused on the mind or mental adjustments. So those are very powerful, low-cost techniques. Powerful in the sense you may not need to meditate long. Maybe a few minutes meditation enough to alleviate the stressor and let the mind purge all that stress hormones out of the blood. And nowadays, these are being used as micro meditations. For non-meditators, there are micro meditation techniques coming up where you can take a meditation thought, like mindfulness thought, only for a few minutes. So a micro meditation for people who don't want to do meditations in the long run. So remember, these are most healthy methods and lowest cost techniques if you can adapt to them. So this is where the meditation subject is. Once you learn these meditation techniques, you will find that they are the most effective against any kind of stress. And meditation can be not only used for managing stress, but it's good for developing mental health to a higher level. From an average person's mental health, you can take it to a higher level where mental health could be even raised beyond normal through concentration and absorption states and all that. Okay, so remember these healthy methods. So if you have opted to unhealthy techniques, they can soon become habits which could not be removed. So before they become habitual, quickly switch to these healthy methods. And meditation or micro meditation, I strongly recommend. And if possible, yoga as well. Yoga may need some physical space and some equipment, whereas meditation you can be doing on the go, wherever you are, while walking and while doing any activity. Nowadays there are micro meditations called mindful eating, mindful walking. So mindful eating is about the tongue, for example. While eating, unhealthy way is you switch on the TV or watch a movie while eating. That's unhealthy way because there are many complications coming. When you eat in mindful eating, first you will have to look at what you're going to eat and identify them. This is rice, this is that. And that awareness in the mind is very important for activating all those digestive system hormones. Even the part of the digestion happens in the mouth by saliva. So it will release the saliva, it will release the correct level of hormones to the stomach, correct level of the liquids to the stomach for digestion. So therefore, you spend little time in order to become mindful about what you are going to eat, what are the items there on the plate. Think about them and think about their taste and then take it to the mouth, and while you are chewing, and you can always think about that action and the taste, action and the taste. It's a micro meditation to be practiced during eating, known as mindful eating. So they are coming as therapies nowadays. But why do we pay for it as a therapy? Why do we want someone like a doctor to recommend to us? Because we can do it alone. So that is, those are the parts of meditation that you can incorporate in your daily lives. Because you know the rule of the mind is this, we did it earlier. If a particular set of thoughts are repeatedly engaged and more frequently used within the mind, slowly the mind and the mental thought process will bend towards that particular set of thoughts. This is the rule of the mind. So whether the set of thoughts are good thoughts or bad thoughts is your choice, which means that they become habitual slowly. Anything will become slowly a habitual practice. That's why we need to opt for the healthy methods. In meditation, we know meditation thought, repeatedly engaged into the mental loop, saying to yourself, engaged in a fruitful self-talk that will remove stress chemicals out of the blood. Remember, draining stress chemicals out from the blood is an inside job done by your mind, Right? And if the mind is not doing it, that's your fault then. So you should get the mind or train the mind to do it. So use of proper meditation technique is found to be one of the most effective ways in getting that done. And meditation can elevate the mental health further. It's broader than the absence of any mental illness. And mental health is defined as a state of well-being, not only mentally, physically as well, connected to physical health and behavior. And this part, mental health, coming up now in the medical sciences. And they say promoting mental health will enhance happiness, self-esteem, ability to control or enjoy your own life, ability to form loving and supportive relationships, emotional resilience, physical well-being, and productivity. Right. That's coming up now for people to be aware of the mental health daily or momentarily, even at every moment, so that you can continue to live happily. Okay, so that's all we will discuss about the stress management technique. We know now they are slowly being converted to mental health management techniques. Okay, we will stop the discussion here and have the break. After the break, I want to join you with the cameras on because we will be practicing some meditations. This time, we'll be practicing them in the way of removing all the hindrances from the mind. Right? That 5-pronged attack we discussed earlier to attack the 5 hindrances, we will try today. Okay, thank you and have the break there.